Welcome to Chesapeake Public School Virtual Health Fair. I'm Gray Lipford. I'm your wellness coordinator for Chesapeake Public Schools. Today, we're going to learn more about the services offered at our health centers, especially services related to weight management. We have several different providers here who's going to talk about what they do and how they can help you live healthier, happier lives, as well as reach your goals. First, a little bit of housekeeping. Since this is a live stream, your cameras and microphones will not work. But if you have questions, you can always post in the chat. I see a lot of people saying good morning, which is great. But yeah, so if you have any questions, go ahead and post there. But do remember that the chat can be seen by everyone, so don't post any personal health information there, okay? After the live stream is over, you can always set up an appointment with our health centers or give them a call to ask your questions. Or if you have general wellness questions, you can always email me or give me a call and I'll be happy to help. Now I would like to introduce Vincent Pasquale, who is our relationship manager with Marathon Health. And he's going to provide an overview of our health center services, and he will also introduce each of our speakers. Vince?
Fantastic. Thank you, Greg. Good afternoon, everyone. Let me go ahead and share my screen. Let me shift over here for a second. Share this window and we'll get started. There we go. All right, fantastic. Hopefully everyone can see my screen okay. We'll go ahead and get started. And thank you, Gray, for the intro. And thank you all for joining this afternoon, for just taking the time out of your day. And most importantly, thank you for the work that you do supporting students, school community. We totally understand your schedules are busy, full. Finding a time for your own health and well-being isn't always easy and can sometimes be challenging. So as Gray mentioned, for today's session, we're going to learn about your health and wellness services at both locations for Chesapeake Public Schools. As Marathon Health, are available here for you to help design and make healthcare simple, convenient, supportive, and we're here for your overall health and well-being. If you don't know Marathon Health and ever visited our health centers yet, Marathon Health partners with Chesapeake Public Schools and many other school districts across country to bring healthcare closer to employees, teachers, administrators, support staff, and eligible family members. This is a great benefit that exists to make it easier for you to stay healthy, manage ongoing conditions, and get care without having to have the long wait times or unnecessary stress. Marathon Health's focus is on caring for people that care for others, in simple terms. But in terms of our overall services, I'll let my friends here and experts in each of our lines of services to give a little more in depth of our services. But from a high level, Marathon Health has an integrated complete care model that you can meet pretty much about 90% of your everyday healthcare needs at both locations. We offer primary care services for your annual wellness visits, common colds, acute care visits. We support chronic conditions like high blood pressure, diabetes, and asthma, behavioral health services, and preventative care, medications, and ongoing follow-ups. We also offer nutrition and health coaching services, but really, I don't want to steal the thunder. I have some amazing experts and friends and subject matter experts that are going to do a wonderful job of giving you more information for each line of service. So I'm going to go ahead and give Karen Field Sykes, who's our amazing nurse practitioner and one of our providers at our Christina Way location. And I'm going to toss it over to her to go ahead and give you a quick overview of our medical services. So Karen, I'm going to toss it to you.
Thanks, Vince. Hi, everyone. Thanks for giving me an opportunity to just talk to you about how we want to care for you and how we feel about you. So first of all, I want to say thank you. I want everybody to know that Marathon, though it says the name Marathon, this is your house and we are visitors and we're here to take care of you every single day. So I am at the Christina Way, and we're here from 7 a.m. to 5:30 in the 5:30 in the evening. I think Vince did a great job to talk about our acute and chronic diagnosis, but I want you guys to know that we're here to do your annual physicals. We can do your lab work, as well as if you need to get any referrals to any specialties, we're here for that. We also like to do your biometric screenings. That is something you should do yearly. Um, you could do you could get it in a double. We could do it in different ways. First way, we do some off-site screenings, but we also able to you to come to any of the centers to get your biometric screenings. If you have a PCP, if you get your annual lab work, you should also bring those lab work to the center, and that will also count for your screenings. We also like to manage your weight if you like to. We work very well together. We have a nutritionist. We also have our behavior health team, as well as the nurse practitioners to discuss anything that might be related to your weight. So we're here for that. We also like to manage your hypertension, your hyperlipidemia, diabetes. The thing about our diabetes, we have a program that I feel like helps you not only manage your disease, but also with your medications costs. And with that, if you have any questions and you're interested to be part of the diabetes program, you can just call any one of our office and we can help you with that as well. What I like to do as well is that I don't know if you all know this, but we also have a lab service. And even if you get a order from your PCP and you want to come to the center to have those labs ordered, we have that available as well. All we would need is to bring that order around 24 to 48 hours. We make sure that we're able to complete all of those labs, and then we'll schedule an appointment. We have great nutritional service where Vince says, and Lydia is part of that team. We have health coaching, like we talked about. We do diabetes, we do weight management. If you're concerned about your hypertension, hyperlipidemia, we're good with that as well. With our acute services, you don't feel good that morning. Most of the time, we're able to give you an appointment right the same day, but if not within the 24 to 48 hours. So you come in, you don't feel good that morning, come see us. Don't wait for your PCP. We're here for you. That's our job, okay? If you have any questions, I want you to know that we are here for you. We have a great team. The nurses are mastered or doctorate prepared. And so we're here for you, just for you. Thank you so much for giving me that opportunity, Vince. I'm going to send it right on back to you.
Karen, you're amazing. Thank you so much. Wanted to also just add, this is for those that are covered on the Chesapeake Public Schools health plan. This is for employees, spouses, retirees. We want to make sure, and to Karen's point, the difference with Marathon Health Services, Karen does a wonderful job in our provider team and spending more time with you and pretty much meeting you where you're at. We're not going to have you rush in and see the provider for 5 minutes and out the door. You're not going to have long wait times. So we will get you in and seeing Karen in a pretty quick and efficient way. So we have another expert, another friend that I want to introduce. If you're not aware and have met Toy Mitchell, she is our mental health provider that's based in an office in our Christina Way location. She'll be speaking to our mental health and behavioral health services. So I'm going to give her the opportunity to kind of review services, explain the benefit to you, and really get to better understand, get some face time with Toy. So Toy, I'm going to toss it over to you.
All right. Well, good afternoon, everyone. And it's such an honor to be with you all today. And thank you so much for taking time out of your busy schedules to kind of really learn more about our services. Again, my name is Dr. Toy Mitchell. I have been with Marathon Health for a short stint, but in that time, I've gotten an opportunity to meet many of you all as I work in this mental health space. And I'm so grateful. You all have a wonderful staff and so grateful to have connected to some of you. And my hope is that I'll connect to many more. And so I want to kind of give a brief idea and just really summation of some of the mental health services that we provide here at Marathon Health. First of all, we again provide services to employees, retirees, and spouses covered by the CPS medical plan at no cost. Also, as well, some of the things that we kind of address are work stress, relationship issues, couples therapy, irritability, depression, all the things, and substance use and alcohol misuse, and much more. We really have a wonderful and really experienced behavioral health, mental health staff here. First of all, Jamie Reese. She is a licensed clinical social worker. She has over 30 years of experience in medical and psychiatric and community care, and she's located at the Washington Shops location from 9 a.m. to 7 p.m. And of course, myself, a licensed professional counselor, again, experienced, and I'm located at the Christina Way location from 7 a.m. to 5:30. So I want to just really emphasize that your mental health providers are capable, competent, and experienced, and we offer convenient therapeutic options, telehealth, because some of you all, I already know your schedules are busy, and you're like, you know what, I don't even have time. Yes, you do. Why? Because we offer telehealth, we offer a variety of telehealth, we offer phone, we offer video, and we also offer various times 30 minutes, 45 minutes. Hey, we get you in where you can fit in because we know that mental health care matters. Now, before I go into just the significance of what May is going to be as far as a pivotal month for us, I want to give a definition of mental health. The World Health Organization defines mental health as a state of well being in which individuals realize their own potential and ability to cope with normal life stressors. Now, why is that important? Because I think sometimes when we talk about mental health, there's a lot of stigma attached to that. But I want to emphasize that it's truly about a state of well-being. And when we think about our lives, I want you to just envision, are there areas in my life that I can improve? Am I really living optimally in this space? And if some of those questions are no, then guess what? This these services are for you, and I want you to know that you're not alone. As statistics indicate, the increased use of mental health services for adults ages 18 to 64, there's been an increase in usage. And so I want to encourage you that we are here for you. And also, too, as we celebrate and acknowledge, May is Mental Health Awareness Month. And so one of the quotes that I really love is this: there is no health without mental health. Let me say that again. There is no health without mental health. It is all connected. So I want to encourage you to please make sure that you know the facts about mental health and not just the myth. Because there's several myths about mental health, but one of the myths is this is that therapy is just for someone with severe mental health issues. And let me tell you, that is not so. Therapy can benefit anyone, no matter where you are in life. So I am encouraging you, if you're like, you know what, I need help with setting goals. I need help in really kind of how to relate to other people. I really need help in managing stress and anxiety. These services are for you. And especially when we talk about the mind body connection, it's a two-way relationship where the mind influences the body and the body influences the mind. And when we talk about weight management, why is that important? Because it is difficult to lose weight when you're chronically stressed. And so Lydia, she's our person for that. But I want to tell you this, that if you're looking for weight management, it also is a part of the mindset as well. And so we want to give you coping skills to regulate stress, to lower those cortisol levels, all the things. And mental health is for you. So again, I want to thank you so much for this opportunity. And just remember, Your mental health matters. So please take the necessary steps to take care of you. Thank you so much, Vince, for this time.
Thank you so much, Toy. Appreciate your time and highlighting our behavioral health services. It's an amazing benefit. And to Toy's point, certainly I invite you all to take time to set up an appointment with Toy or Jamie. They are a wealth of knowledge and certainly will help you with your mental health and well-being. Now we get an opportunity to meet and talk about nutrition. I know Toy touched a little bit on weight management. We'll continue that. And certainly a piece of that is knowing and understanding your nutrition and how we eat and eat healthy. So I'm going to let our resident expert, Lydia Slotky, to go over and review our nutrition services with you today. So Lydia, I'll toss it to you.
Thanks, Vince. Hi, everybody. As Vince mentioned, I am Lydia, the registered dietitian and national board certified health coach with Marathon Health. As you may know, there is a lot of food noise out there when it comes to food. And one of my favorite parts of what I do is bridging that gap between complex nutrition science and the actual realities of your daily lives. But ultimately, the best part of my job is working with you all. As school staff, you are constantly pouring your energy into everyone else. And my goal is to help you pour some of that energy back into yourselves. So you may be asking, like, what does a dietitian even do? So as a dietitian, I am a credentialed expert in food and nutrition. I am not here to hand you like a restrictive one-size-fits-all meal plan. Instead, I practice with evidence-based and highly personalized care. So a dietitian can help you with a wide range of goals. It can be managing chronic conditions like diabetes or high blood pressure, navigating sustainable weight loss, boosting your energy for those long school or work days, and ultimately building a healthier, more positive relationship with food. To give you all a picture of what this kind of looks like in practice, I do want to share with you a recent success story of a teacher that I worked with. She was in her late 50s and came to see me wanting to lose weight and lower her A1C. She originally started in our diabetes program and then transitioned into the one-on-one nutrition counseling sessions. What's important to note is how we started. So we didn't immediately start by like counting calories. Instead, we spent time working through some things tailored to her. So that was working through like mindful eating, body image, tackling those late night cravings that often hit her after a stressful day in the classroom. And so once we really build that kind of like behavioral foundation, sometimes we move more into like the science. So then we began discussing like specific calorie and macronutrient needs, as well as carbohydrates for sustainable weight loss and A1C or diabetes management. And so I'm thrilled to say after about 9 months, she safely lost 20 pounds, successfully lowered her A1C, and she reported feeling completely empowered in her daily food choices. So good nutrition also doesn't just happen in the clinic or an office. It can also happen like in the real world. For example, if we go grocery shopping. So another service that I offer besides just one-on-one counseling is we do nutrition in the aisle grocery store tours that happen every month. And this is just a fun, hands-on way to learn how to confidently interpret food labels, discover more nutritious products, and build a nutritious cart without the stress, or at least some lower stress involved or less stress. So that is all about nutrition services. And Vince, if you could go to the next slide so we can begin talking about health coaching. So as I mentioned, I am also a health coach, but we are going to be getting a brand new teammate here starting soon who is going to be our dedicated health coach. So I am going to first introduce her, and then secondly, talk a little bit more about what our health coaching services entail. So as you guys can see here, this is Rachel, and she actually likes to go by Coach Ray. And she is a board certified wellness coach, certified personal trainer. And she has an emphasis in obesity management with over 9 years of experience helping people improve their health through sustainable life changes. Coach Rach, or Coach Ray, takes a holistic, patient-centered approach to health, focusing on like behavior changes, physical activity, and accountability to help reduce disease risk, manage weight, and improve quality of life. So she does a whole lot, as you can see. She also wanted to provide you guys with some personal information. So outside of her professional work, she enjoys spending time with her husband and family, serving in ministry, and encouraging others to live healthier, more purposeful lives. So Rachel is going to be a great addition to our team, and she will be available for scheduled appointments starting sometime in early May. Last thing here is, if you don't know what a health coach is, what they really do is just help, or they are credentialed in the psychology of behavior changes. So as you can see here, she can help with sleep quality, increasing your physical activity, weight management, and just helping create a better work-life balance. So I would encourage you all, when she is available, to either get on her schedule, or you can also come and see me. Back to you, Vince.
Fantastic. Thank you, Lydia. Awesome job. And really welcoming Rachel, Coach Ray, to the team. You guys are getting the full spectrum of services to help with your overall health and well-being. Certainly looking forward to everyone meeting Rachel and the care team. I am very blessed to work with such an amazing and wealth of knowledge team in all the aspects of mental health, medical, nutrition, and health coaching services. So just to kind of wrap, and I'll toss it back over to Gray here in just a second. Really, what does this mean to you as access to both health centers and these amazing benefits? This is really designed to help reduce time away from your work, help manage stress, chronic conditions, provide continuity of care throughout the school year. And we want to make healthcare feel supportive instead of overwhelming. When your health is supported, it's easier to stay energized, present, and focused, both at work and home. And most importantly, costs and services are free. So we can't beat that, and certainly appreciate our care team jumping on, sharing each of our services, and really looking forward to everyone taking advantage and meeting our care team at some point in the near future. I'm going to go ahead and just share one last thing with regards to meeting with them. How to schedule an appointment. It's pretty straightforward, very seamless. We want you to have the opportunity to seamlessly meet with our care team. We do have a patient portal that's it's very easy to navigate through, be able to register, jump on, and then be able to schedule your appointment. So a couple things to first start off: make sure to download the patient portal under My Marathon Health or my.marathon.health. And then you can also just, as you're sitting here watching, you can jump on with your mobile device and be able to download with the QR code here as well. Once you download the app, you'll have access to be able to schedule appointments immediately. And then, of course, just reiterating each location, very close in terms of, very close to SAB, right there at Christina Way. And then we also have the other Chesapeake location of Washington Shops off Old George Washington Highway. So wanted to make sure you knew, and if you have any questions, feel free to call either location or feel free to email us too as well. I did want to give one more plug before we wrap up, and I'm going to toss it back over to Gray and give him opportunity because you'll be able to see them live. So I want to give and toss it back over to Gray and give him his rep and opportunity to share this upcoming event.
Thank you, Vince. And thanks to Karen and Lydia and Toy. I'm sure everybody learned a lot about what they do and how you guys can help them. I just want to point out again that all the services that are available at our health centers are absolutely free to any employee, spouse, or retiree who has a CPS Anthem health insurance plan. Anything that you do there is $0 copay. You can have as many appointments as you need for as long as you need in order for you to reach your goals. We have our health centers have a 97% satisfaction rating. You can almost in 90% of the time when you go to make an appointment, you can get a same day appointment or a next day appointment in about 90% of those cases. And again, in about 87% of the time, once you arrive for your appointment, you'll wait less than 10 minutes to see the provider. And so even if you have your own primary care physician, you can still use our health centers. In fact, if your primary care that you love says that here's an area that you want to work on, you can use our health centers to work on that. Of course, if you do need a new primary care physician, our health center staff would love to help you there. The other day, someone came to me and said that their primary care was retiring, and the person they called had a 3-month waiting list before they could get an appointment. We walked down and got them an appointment for that very next Monday to start their new primary care work. So definitely take advantage of all the areas that we have to offer. You can make an appointment, as Vince said, either by calling our health centers directly, or you can go onto the portal and make your appointment online. If you don't already have an account on the Marathon portal, even if you aren't ready for an appointment now, go ahead and create an account on the Marathon portal. That way it's available when you do want to make an appointment, as well as there's a lot of information and other resources that are available on that Marathon portal. They do have a mobile app, which you can access almost all of the same information through the mobile app as well. I also wanted to make sure that you know that we have another opportunity for you to meet our practitioners, and that is a in-person health fair on Friday, May the 8th, right here at the school administration building. It goes from noon to 5:30. Now, if you don't remember, that's an elementary teacher work day, and so we've asked that you guys be given the chance to attend that if you want to. That's May the 8th. noon to 5:30 here at the school administration building. We'll have our practitioners here so you can do your biometric screening if you haven't already done it. We'll have mental health screenings. We'll have, you can ask questions of our providers. We're also going to have some financial wellness providers here as well. So if you have questions about finances, we'll have individuals here that can help you with that. And we'll also have some games and some snacks and some swag. So come on out. That's Friday, May 8th, noon to 5:30. All right. Well, that's all we have for you today. And again, if you have questions, contact the health centers, or you can contact me via email or phone. Thanks everybody for attending. And again, this is recorded, so we will put out a video in case you want to watch it again. And we will see you on May 8th. Thanks everyone.